You've been sitting there for 45 minutes, maybe an hour, feeling that pressure, that fullness, and nothing is happening. Your body is screaming at you to push, but it won't respond. This is not ordinary constipation, and a simple home remedy won't fix it. What's happening inside is far more serious than most people realize. I'm going to walk you through exactly what's happening, why it's dangerous, and 5 natural methods to clear the blockage before it becomes an emergency. First, you need to understand what's actually going on inside your body right now. The medical term is fecal impaction. Let me tell you what that actually means in plain language, because the clinical term lets people underestimate how serious this truly is. Picture your colon as a slow-moving river. For years, it flowed steadily. Everything downstream got what it needed. Now imagine that over the course of a week, very gradually, very quietly, the water slows down. Maybe there was a dry spell, maybe some debris piled up in a narrow section. The river doesn't stop overnight. It just slows and slows until one day the debris has compacted so tightly at one particular bend that water literally cannot flow through anymore. That compacted bend is what's happening inside your colon right now. Your large intestine is essentially a muscular tube with one main job: move waste material toward the exit while absorbing water from that waste. Under normal circumstances, this is almost automatic. Waste moves, water gets absorbed, stool stays soft enough to pass comfortably. But here's where aging changes the game. And this is something every person over 60 needs to truly internalize. As we get older, several things happen simultaneously in the digestive system. The muscular contractions that propel waste through the colon, those rhythmic squeezes called peristalsis, slow down. The nerve signals that coordinate those contractions become less efficient. And thirst sensation decreases, which means many older adults are chronically mildly dehydrated without even knowing it. Then there are the medications: blood pressure drugs, iron supplements, calcium channel blockers, certain pain medications. Many of the most common prescriptions for people our age directly slow bowel motility as a side effect. Put all those factors together, and you have the perfect internal environment for stool to move through the colon too slowly, sit in the lower segment too long, lose too much moisture, and transform from something soft and manageable into something hard, dry, and essentially immovable. By the time 5, 6, 7 days have passed without complete emptying, that stool has dehydrated into a dense solid mass that simply cannot fit through. The pressure you feel is real. The exhaustion from straining is real. And the fear that something is seriously wrong is also completely justified. And here's why this fear is justified: because what starts happening inside your body next is genuinely dangerous. People hear the word constipation and think inconvenient but harmless. A fecal impaction is neither of those things. Let me walk you through what begins to happen inside your body when a large hardened mass sits stuck in your rectum for an extended period. The first issue is structural pressure. Your rectum is not designed to hold a cemented, dehydrated mass indefinitely. It's a flexible structure, yes, but it has limits. When it's chronically overdistended, the blood supply to the tissue lining the rectal walls becomes compromised. The cells that line that wall need oxygen and nutrients from blood. When circulation is cut off or significantly reduced, those cells begin to struggle. In severe or prolonged cases, this can progress to tissue injury that requires medical intervention to repair. Now here's something that genuinely surprises most people when I explain it. Your rectum and your urinary bladder are neighbors. They share a very confined pelvic space, separated only by a thin, fibrous wall. When your rectum is packed with a solid, rigid mass and stretched well beyond its normal capacity, it physically pushes against the bladder. For women, this pressure is often more pronounced due to pelvic anatomy. What patients experience is a sudden and confusing difficulty urinating. A feeling of constantly needing to go, but only passing a few painful drops. Or in severe cases, not being able to urinate at all. I've seen people genuinely convinced they had developed a bladder infection overnight. The real cause was a rectal impaction compressing the bladder from behind. Once the impaction was addressed, the urinary symptoms completely resolved. But there's one more symptom I must warn you about, specifically because it confuses people so profoundly that they end up making things dramatically worse. It's called overflow incontinence, and it looks on the surface exactly like diarrhea. Here's what happens. The solid mass blocks the main exit, but your intestines are still producing liquid waste higher up in the digestive tract. That liquid has nowhere to go except to seep around the outside edges of the hard blockage. Like water finding a crack in a dam, and it leaks out unpredictably. People see this liquid and think, I clearly don't have a blockage. I'm having diarrhea. And some people tragically go to the pharmacy and buy anti-diarrheal medication to stop it. This is one of the most dangerous mistakes you can make in this situation. Anti-diarrheal medication shuts down the movement of your intestinal muscles. You paralyze the very mechanism your body is using to work around the problem, and you cement that impaction even more deeply into place. If you're experiencing what appears to be diarrhea, alongside days of feeling like you cannot fully empty, consider the possibility that it's overflow, not true diarrhea, and do not medicate it without speaking to a doctor first. Fecal impaction doesn't hit everyone equally. It disproportionately affects adults over 65, and the risk climbs significantly with each decade after that. In nursing homes and long-term care settings, some studies suggest it affects more than 40% of residents. It's one of the most common gastrointestinal emergencies in geriatric medicine, and yet it's also one of the most preventable once you understand what's actually creating the risk. Reduced mobility is enormous. Walking, even light housework, creates gentle rhythmic pressure in the abdomen that physically helps keep intestinal contents moving. When mobility drops, because of arthritis, a recent surgery, a fall, or just the gradual slowing that comes with age, that mechanical stimulation disappears and the colon slows down with it. Dietary changes stack on top of this. Many older adults eat smaller meals, less fiber, and drink less water, partly because the thirst mechanism becomes less reliable. Less bulk and less moisture means stool that's already prone to hardening. Medications compound the problem. Blood pressure drugs, certain antidepressants, iron supplements, opioid pain relievers. Many of the most commonly prescribed medications for older adults list constipation as a direct side effect. When you're taking 2 or 3 of these, the combined effect can be significant. And then there's suppression. Many older adults grew up in a time when talking about bowel habits was deeply taboo. They feel the urge, but it's not convenient, so they hold it. Over months and years, the rectum becomes less sensitive to that signal. The urge gets quieter, waste sits longer, and the risk of impaction rises. Understanding your own specific risk factors is the first step toward making sure this never happens again. But right now, if you're in the middle of this crisis, here are the 5 natural methods that can help you clear the blockage. First instruction, and hear this clearly: stop straining. It doesn't work on a solid dehydrated impaction. What it does is increase your risk of hemorrhoids, anal fissures, or dangerous blood pressure spikes from excessive pushing. So stop pushing, breathe, and let's work through this systematically. Olive oil isn't just a healthy food. It's a mechanical lubricant that coats the intestinal walls and helps hardened stool slide out. Take 2 tablespoons of high-quality extra virgin olive oil on an empty stomach, ideally first thing in the morning. Follow it with a full glass of warm water. The warmth relaxes the smooth muscle of the colon while the oil creates a slick coating. Now, wait 30 to 45 minutes. Do not rush to the toilet. The oil needs time to work its way down and coat the mass. For more immediate relief, you can also use olive oil as a gentle retention enema. Warm 2 to 3 tablespoons slightly. Use a bulb syringe. Lie on your left side, administer slowly, and hold for 15 to 20 minutes. This delivers lubrication directly where it's needed. There's a muscle called the puborectalis that forms a sling around your rectum. When you sit upright on a standard toilet, this muscle creates a kink that makes elimination harder. The solution is simple. Use a small footstool or a stack of books to elevate your feet so your knees are higher than your hips. This straightens the anorectal angle from roughly 90 degrees to a much more open passage. Now, the breathing technique. Instead of holding your breath and straining, take a deep breath in, then exhale slowly through your mouth, making a gentle moo sound, like a deep hum. This relaxes the pelvic floor muscles and creates gentle downward pressure without the dangerous blood pressure spike. Combine the elevated position with this breathing for 5 to 10 minutes. Even if nothing happens immediately, the mechanical opening of the passage is critical. Now, while your body is in this optimal position, there's a manual technique you can use to stimulate movement from the outside. This is a specific manual technique that physical therapists and massage therapists use to stimulate peristalsis, those wave-like contractions that move waste through your colon. Lie on your back with your knees bent, feet flat on the floor or bed. This relaxes the abdominal wall so you can reach the colon more effectively. The eye stroke. Use the flat of your fingers. Start just below your left rib cage and stroke downward in a straight line to your left hip bone. Repeat 10 times with moderate pressure. The L stroke. Start under your right rib cage, stroke across to the left side, then down to the left hip bone, forming an L shape. Repeat 10 times. The U stroke. Start at your right hip bone, stroke upward to your right rib cage, across to the left rib cage, then down to the left hip bone, forming a complete U. Repeat 10 times. This follows the exact path of your ascending colon, transverse colon, and descending colon. Do this for 5 to 10 minutes total. The pressure should be firm but never painful. You're guiding the contents along, not forcing anything. Magnesium citrate works by osmosis. It pulls water from your body into the colon to hydrate and soften the hardened mass. This is one of the most effective natural methods for breaking up an impaction, but dosing matters enormously. The standard dose for adults is 200 to 400 milligrams of magnesium citrate powder dissolved in a full glass of warm water. Drink it slowly, over 15 minutes. Don't chug it. Now here's a critical warning, and I need you to take this seriously. If you have chronic kidney disease, your kidneys may not be able to clear excess magnesium from your blood, and high magnesium levels can cause dangerous heart rhythm problems. For CKD patients, consult your doctor before using magnesium and never exceed 200 milligrams without medical supervision. Also watch for signs of magnesium toxicity: nausea, dizziness, muscle weakness, or slowed breathing. This isn't just a precaution, it's a real safety concern. If you have any kidney impairment, skip this method entirely and focus on the other 4. After taking magnesium, wait at least 2 hours, stay near a bathroom, and keep drinking water throughout. If magnesium isn't right for you, or if you want to combine approaches, the 5th method uses 2 ingredients that work together to create a slippery flush. Food-grade aloe vera inner leaf gel contains mucilaginous compounds that create a slick, slippery coating along the intestinal walls. Prunes contain natural sorbitol, a sugar alcohol that draws water into the colon, plus fiber that adds bulk and stimulates movement. The recipe: blend 2 tablespoons of pure food-grade aloe vera gel with 4 to 5 pitted prunes and a cup of warm water until smooth. Drink it warm, not cold. Warmth relaxes the smooth muscle of the colon. Cold can cause the muscle to tense up, and you want relaxation right now. Drink this slowly over 10 to 15 minutes. Then lie on your left side for 20 to 30 minutes. This combination works on 3 fronts simultaneously: lubrication from the aloe, osmotic draw from the sorbitol, and gentle stimulation from the fiber. These are the moments when you must stop and seek medical help immediately. If you've tried these methods and nothing has passed after 24 hours, it's time to go to urgent care or the emergency room. This is not admitting defeat. This is making a smart medical decision. If you experience severe abdominal pain that is constant and not just cramping, go immediately. If you develop a fever, chills, or start vomiting, these are signs the impaction may have caused a more serious complication. If you have a complete inability to pass gas, this could indicate a full intestinal blockage, which is a surgical emergency. If you notice any blood in your stool or on the toilet paper that is more than a few drops, seek medical evaluation. At the hospital, the clinical team has access to therapeutic enemas and imaging that can assess exactly how extensive the impaction is. In cases where clinical enemas aren't enough, a specialist will perform manual disimpaction under sedation. It's uncomfortable to think about, but it's safe, routine, and the relief afterward is extraordinary. Once the impaction is cleared, your body enters a brief recovery phase. The rectal tissue is irritated and sensitive for 24 to 48 hours. Warm sitz baths for 10 to 15 minutes, 2 to 3 times a day, promote healing. Your diet for the first few days should be soft, easily digestible, moisture-rich foods: oatmeal, cooked vegetables, soups. Long-term prevention rests on 4 pillars: consistent hydration, even when you don't feel thirsty; daily movement, even if it's just a 20-minute walk; dietary consistency with soluble fiber introduced gradually; and scheduled bathroom time every morning within 30 to 60 minutes of breakfast. Do not rely on stimulant laxatives as your long-term solution. They train your colon to become dependent, and when you stop taking them, the colon has largely forgotten how to initiate movement on its own. And that's the full protocol. This is a crisis your body is telling you about. And you now have 5 natural methods to address it before it becomes an emergency. If you found this helpful, share it with a family member, a friend, a neighbor. Anyone who might be quietly suffering with this and not saying a word about it. Click the like button if this helped you. And subscribe so you never miss our upcoming videos on digestive health and taking control of your health as you age. Take care of yourselves, drink your water, move your body, and I'll see you in the next one.